My name is Dr. Jagdish Chaturvedi. I am a practicing ENT specialist from Bangalore, and I'm the clinical director of a medical devices company called Inaxcel. I am the co-inventor and co-developer of about 18 medical devices that are designed and priced and engineered for the Indian healthcare system. In order to spread the failures, the experiences, the challenges in a humorous as well as in a very realistic manner, I have authored a book called Inventing Medical Devices, A Perspective from India, which has been in the market since the last 1 year. One is that it is extremely simple and it's easy to read. It's written in a very simple language, and it is meant to give an overview of the roadmap when any engineer, designer, doctor, entrepreneur from India wants to develop a new healthcare solution for the Indian market. The second unique thing about this book is that it shares things that nobody typically would share with anyone. For example, cost-related information, salary-related information, pricing-related information. If there is a deal between a company and a manufacturing firm, what are the licensing terms? How much do lawyers charge? What are the ways somebody can raise funding? The links for all of the government source fundings or private source fundings. Basically, this book has compiled a lot of resources for any entrepreneur, and to ensure that if anybody is entering into this field in India, they have a reference point. There are a lot of humorous caricatures. There are about 50 plus caricatures that have been custom designed that talk about ways that doctors and engineers today deal with medical device inventions, clinical challenges and hurdles, and all of them have a humorous tone in them. While I was a postgraduate student at St. John's Medical College training to become an ENT specialist, Dr. Nair was the head of department at that point of time. And then is when we faced a problem of patients coming with throat cancer, which were not detected very early on in the rural areas, were coming to us with very advanced cases of cancer lesions. And we used to use a very expensive 3 to 4 lakh rupee device to put in a camera inside and look at the cancer lesion. At that point of time, I questioned Dr. Ravi Nair, couldn't there be an easier way to look inside the throat through a videography way, somewhere in the rural areas? And he basically nudged me to find and solve a problem rather than simply talk about it. And that's what got this whole thing started, when I took an off-the-shelf camera and figured out a way to attach it to any endoscope and could replicate the same kind of endoscopy at 1/10 the cost of these large capital equipment. A doctor, an engineer, and a designer and a scientist, we all club together and make observations in a hospital for a period of 2.5 months, and we see hundreds of problems, and then we score them in a systematic manner based on the incidence, prevalence and market understanding, and then start to filter them, score them, and then come to the top need. What is my message to people or entrepreneurs in the country? I think the most important thing that I've learned from trying to invent devices for the last 6 years is that it's very important to have a team early on. If you have an idea and then if you start to look for a team after that, they end up becoming your employees and it becomes contract engagement. If a team and you, which has an engineer, designer or doctor, identify the problem together, understand the problem in great detail, and then invent a solution together, then that's more of a teamwork that can form into a company where the engineer or designer can take the product forward, whereas the doctor can be an advisor or a clinical director of the company to make sure that he continues his clinical work and the product moves forward through the engineering process for about 2 to 3 years so that the technology reaches the market. It's just a matter of executing it. The other couple of takeaways that I can share is that have realistic expectations. Doctors have ideas, but ideas are worth only so much. Getting them out to the market is a much bigger and expensive game. So having realistic expectations on returns, understanding the business early on, understanding the stakeholders, market, everything early on makes a big difference in getting your product out more successfully. And follow me on Twitter at drjagdishchatur for keeping in touch with me and sharing your feedback. Thank you very much.